We're recording on this computer. This is MED120 4NAX, term 4. This is Dr. Garais, and today is Monday, September 21, 2020. And we are about to go over Module 8. Module 7 or Week 7 items are due tonight. So what is Week 8 all about? And if you could kindly mute, that would be greatly appreciated. And I'll try to monitor for questions here in the chat. So Module 8, what are we doing? It's the reproductive system. So let us go. Of course. And then, oh, you know what? I just realized something. I need to be in Firefox. So let's get into that. So the reproductive system. Now, the two people in the neighborhood of the reproductive system is the Department of Urology and the Department of Obstetrics and Gynecology, also known as OB/GYN. Now, what is the difference really? Now, the Department of Urology, LOGI, study of urine, or the urinary tract, traditionally has been for the male patient with any fertility issues. But if it is a female patient, if the patient is not pregnant, then it is the Department of Gynecology, LOGI, study of gynae, women, and the Department of Obstetrics is the department responsible, of course, for labor and childbirth. So let's go reproductive systems, go to chapter 8, and we should be good. Okay, this is, of course, stirrups. Now, OB/GYN or OB/GYN, OB/GYN, that is the same person. They're not two different people. Typically, the Department of Obstetrics and Gynecology, they'll have two teams. And then for like one half of the year, there'll be obstetrics dealing with women with labor and pregnancy issues, and gynecology for generalized women's issues. Now, the Department of Urology, of course, urine, is typically, if it's a fertility issue with the male, the Department of Urology would see the male, the Department of Gynecology would see the female. But nowadays, they have something called urogynecology in most fertility centers. So the same person would see the future mommy and potential future daddy at the same time, which is kind of neat. So let us focus here on the female anatomy, and don't need to know this picture and these pictures, but it's just nice to see where everything is. So of course here is the uterus and the vagina. Now the vagina or the vaginal canal, the orifice, also known as the introitus, that's the opening. But the actual muscular tube, that is the vaginal canal. Then you would also see here on parallel track is you have your urethra and the female rectum as well. Okay, and of course here's the bladder. Up here is the ovaries connected to your fallopian tubes, then connect into your uterus. There's two sets of ovaries and two sets of fallopian tubes. And the function of the ovary is to create one fertile egg every month, give or take 30 days. And if it implants with the sperm, it will be in the anterior portion of the uterus. Okay, and of course, since the vaginal orifice or the vaginal canal has potentially open for infection. Hello, someone asking a question? You have your labia majora and your labia minora, of course, major and minor coverings for not only the urethra, but also for the vaginal canal as well. The space in between the vagina and the anus is called your perineum, and that's why. Well, now I'm getting into an anatomy lecture, and I don't want to get into an anatomy lecture right now. But just to give you perspective, when we start talking about the different anatomical parts. But again, this is a medical terminology class. Let us focus on the words. So amniocentesis, we already learned that like week 2. We already know it's a surgical puncture of the amnion or the amniotic sac, because once baby, if this baby here is implanted and it grows itself within a sac and it's in here. And a really neat way to look for any potential birth disorders is to get some fluid from the amnion, and that's amniocentesis. Cervix, cervix literally means neck. So your cervix uteri is this part right here of your uterus. So this is probably where baby's going to implant somewhere here, and this is your cervix here. This is the location of your pap smear. And your pap smear is really important because it can diagnose cervical cancers and other cancers very, very early. And we take samples from the internal os, which is the inside here, external os or opening, which is here, and of course part of the vaginal canal here. And that is called your Papanicola smear, also known as your pap smear. And of course we send that test to cytology, which is part of the Department of Pathology. Sometimes to do that pap smear, I could use a Copascope. So I perform colposcopy, or the obstetrician or the gynecologist will perform colposcopy. Of course here, the pap smear. Herniation is, we already discussed, is something that's sticking out that shouldn't be sticking out. I think that's the easiest way to talk about it. And if mommy has a lot of babies, like 11 or 12 babies, what happens to the pelvic floor or the muscles of the pelvic floor here? Everything starts dropping out, and that is called prolapse. So vaginal prolapse, the vaginal tube will start pushing out. Rectal prolapse, remember anus is the opening and the sphincter here. You can see the muscles around here. And the rectum will also prolapse. Sometimes even potentially the urethra as well, but more commonly these two tubes. Because, you know, when you have a lot of babies, there becomes a weakness of the pelvic floor. Gyneco, of course. Oh, I skipped. Milk. Galactose. Os is a sugar. So galact means milk. So galactose is milk sugar. Galactorrhea, if you have an abnormal discharge or flow of milk. Remember, we like being in the middle. Too much is never a good thing. Lactogen is something that generates or produces or originates milk. So a lactogen could be a hormone like prolactin that pushes and supports the production and secretion of milk. Gynecologist, we got already. Now, hysterectomy. Ectomy is to cut out. Hyster is the uterus, also known as the womb. That's why, ladies, don't take it too kindly when someone calls you hysterical. Because what does hysterical mean? It means you're crazy, or you're not making any sense, or you're so funny that I have to laugh in your face. And you could see how it's kind of insulting, because it's saying that you're funny or you're crazy because it's that time of month. So calling a female patient or a female colleague hysterical, it might not be a good choice of words. And you can now see the meaning of words when you really look at its literal translation. Now let's look at this abbreviation. Oopsies, wrong thing. Since I'm now at hysterectomy, let's look at this 95% TAH BSO, pronounced tabaso, also known as your total abdominal hysterectomy with bilateral salpingo oophorectomy, also known as the TAH BSO or tabaso in medical slang. So when we look at that, what did we do? One, I entered the surgery via the abdomen. And what did I do? Removed one uterus. Removal, ectomy. And then I had bilateral. That means the next two things, bi means two, later means sides. So I removed two salpingo fallopian tubes. And last but not least, I also removed two ovaries, because ovum is a single egg. Okay? So when you look at that, doesn't that look like a beautiful all of the above question? It could be anything, but now you know female anatomy has one uterus, two fallopian tubes, two ovaries. If I remove all of that, mommy can no longer, or our patient, female patient of course, can no longer have children. Now, the reason why we do something like this is because there's probably some serious threat of cancer, or there is an ongoing chronic issue that will end that the patient no longer wants or needs to have any more children. So we do something like this. Okay, and that's tabaso. So where are we? Uterus, uterovaginal, right? Pertaining to not only the uterus, but the vaginal canal as well. So an example of a uterovaginal test is a pap smear, because it not only pertains to the uterus, it also pertains to the vagina and can diagnose not only cervical cancer, but even vaginal wall abnormalities as well. Menorrhagia, menses means month, your monthly menstrual cycle, and menorrhagia means my patient's having an excessive menstrual cycle, bursting forth. It's almost to the point of hemorrhage, which is the origin of this word. Endometritis, itis, inflammation and infection of endo, within the womb. So within the endometrial lining. You also have a myometrial lining, which would be the muscular layer here. You also have the what? See this white stuff all around here, right? That's your perimetrium, right? So you can use your medical terminology powers when you're looking at anatomy or for your anatomy class. Prenatal means nat, pertaining to before birth, postnatal, pertaining to after birth, perinatal, pertaining to during birth or surrounding the birth. So you have your prenatal workups, you have your postnatal workup, and you have your perinatal report, or your the obstetric report of how everything went down. And you will learn that when you are in your obstetrics, and it is an adventure. It is a hoot learning all of that stuff. Oophorecoma, that's tumor of my ovaries. Ovariorexis, rupture of an ovary. And you can have that, and usually you can also have a torsion of your ovaries, because if you look at the picture here, you see your ovaries, they're connected here via these little finger-like projections called your fimbriae, and then your fallopian tubes. Sometimes your fallopian tubes twist around and then you get torsion, and it starts causing a lot of pain in our patient. Perineorrhaphy. Say that 8 times fast. That's your suture of your perineum. I have to cut this, a piece of it. And sometimes if I'm too aggressive, or if the baby's too big for the vaginal canal, this will rip. And then we have to suture that down. And that's never a good thing in obstetrics. Perenniorrhaphy, that's what that is, suture of your perineum. And you could see it's deep. You have to do vertical mattress and then another set of sutures on top of it. Salpingo, we already have that. Your vulva, remember that we discussed the opening or the introitus of your vaginal canal? That is what the vulva is. Okay, I'm getting a message. Okay, I thought it was my kids, sorry. Now that, remember that incision of the perineum that we just discussed? Perenniorrhaphy. It's from, I guess, I might have to do a perenniorrhaphy if my episiotomy was too aggressive. And that's when we do for primogravid mommies, and I've got to cut that in order for the baby to pass through the introitus. Because if the baby's too big, like in gestational diabetes, it will rip everything, and that's never a good thing. Vulvopathy, that is any disease of the vulva or the external portion or the ending of the vaginal canal. Arc, menarche, of course, in your initial menstrual period. And the exact opposite of menarche would be your menopause. And at times it's not an exact date, it might be a range of dates. Now let's look at the telephone code so that we can understand words of gravity, not gravity, the thing that, you know, that apples fall from trees, but we're talking about pregnancies, and parity, which we're talking about labor or birth. So let's look at the telephone code. Now there'll be a G, and then some number, then a P, and then some number, and then there'll be like 4 more numbers, but we don't have to go over that. The G part is, of course, the gravity, which is how many times my patient was pregnant. And then the parity is how many times did my patient get to labor, okay? Get to, or childbirth. So if I have somebody who's G0, P0, G0, P0, that means they've never been pregnant and they never gave birth. So that person is nulligravid and nulliparous. If my patient is G1, P1, my patient, this is the first time they've been pregnant, so that's private. My patient is primogravid. First time she's ever been pregnant. And first time she ever delivered primiparous. Now, she had a whole bunch of pregnancies, and my patient is now multigravid and multiparous. And G6P5 means how many times she's pregnant? 6. How many times did she deliver? 5. And then you have 4 more numbers that tell you, like, did you deliver live birth? How many are living? How many died? Which ones died at live birth? That you'll learn when you're in obstetrics. But for my exam, if someone's never been pregnant, never had labor, nulligravid, nulliparous. First time, primogravid, primiparous. Whole bunch of times, multigravid, multiparous. Okay? And that is the first part of the what they call in obstetrics the telephone code. Am I recording this? Okay, good. I thought I had a brain flatus. Brain flatus. Flatus means gas or farting, for your information. Hematosalpinx. Hemat, blood. Salpingo or salpinx, that's your fallopian tubes. Now, the picture that you saw regarding your fallopian tubes, it looks like a pretty big tube, but in real life, it's like 1.5 millimeters wide. So anything in there, like a baby or blood or bacteria, is way too much, and it will block it and will cause infertility issues. Dystocia is state or condition of abnormal or painful delivery or childbirth. Now, toque or tosha, let's look at this very common machine that's in obstetrics, is your tocodynamometer. Let's break that down. Your tocodynamometer is a machine that measures. And what's toque? Childbirth, labor, and dyna is movement. And what are the two movements? Of course, you have movement. It goes movement plus fetal heart rate. Any deceleration in either one, decelerations, meaning it got slow. Like, let's say, for example, we're monitoring the movement or the contractions of the uterus. If it slows down, that's a problem. Then it's an indication of fetal distress, and we do emergency C-section, and then we go and get baby out. Fetal heart rate, any deceleration of fetal heart rate. Fetal heart rate can be as high as like 190, 200, but if it pops down to like 140, and then even if it comes back up, that's sign of fetal distress. It's time we should deliver and move fast. And typically, one way we can really move fast, of course, is an emergency C-section. And C-section stands for cesarean section for the type of procedure that is. Learn more about that in your obstetrics class. Okay. So that's your tocodynamometer. Retroversion, turning, tipping back of an organ. Now, the retroversion is the retroversion of your uterus. That's not good. Do you see how the uterus is faced a certain way? You could also see how also your spinal cord is faced a certain way. Doesn't it look like a one big slip and slide and a ramp so that baby can go out, right? And that's called, there's 3 P's that we consider in obstetrics. That's the passage, the powers, and the passenger. So the passage would be the shape of the uterus, the angle of my patient's hips, and the vaginal canal. So if anything blocks that passage, we're going to have a really tough time getting that baby out. And one of those things is retroversion of the uterus. Instead of the uterus facing this way, it sometimes faces that way. It goes into the spinal column and into the rectum. Now you could see that the baby will now just do what? Will just bump into this wall right here. And that's not a good thing. The other ones, just for clarity, is the passage, the powers, and the passenger. Of course, how the baby is, fetal heart rate, okay? And the powers, how strong is this uterus contracting so that baby will go through. And those are the 3 P's of obstetrics that you have to kind of pay attention to when you are delivering a baby. So let's now look at other things. This is another beautiful view of your uterus. And remember, the implantation is here in the upper anterior portion. You have your ovaries here. There's one here. There's another here. All of this connected by your broad ligament. That's this cape-like thing. Fimbriae, which is the finger-like projections of your fallopian tubes. And you can see there's 2 fallopian tubes, 2 ovaries. You have here your cervix, and that's your internal os. Here's your external os, and here's the vaginal canal, and of course, the rest of the vaginal canal as well. So this is a nice thing. And if you look at this, let's see if I can look at this closer. I can't. What's this mean? No, I don't want to play. But if you look at it, you have the fundus here, and you have the corpus here, which means body, and your cervix. The fundus, or this bump right here, that's the bump that appears on the top portion of your abdomen, and that's the thing that we measure with a tape measure, and that's called the fundic height. And from there, we can guesstimate AOG, or the age of gestation of the baby. And remember, typically it's 40 weeks, give or take, plus or minus 2 weeks. What's this? Oh, subtotal hysterectomy, total hysterectomy. Total hysterectomy with bilateral salpingo oophorectomy, right? The stuff in purple is what we take out. And again, we're taking all of that out. That is a serious operation. And also, we also provide HRT, which is hormone replacement therapy for our patient, because once you remove these ovaries, those ovaries and what they secrete are part and parcel of your endocrine system. But again, the benefits outweigh the risk. So for example, I had a patient, she had multiple polyps in between her pregnancies, and actually had multiple miscarriages in between viable pregnancies because of the polyps. Once she had her 2 children, her and the husband were happy with the 2 children. They didn't want any more. Then Tabasol was performed and removed all of that. Here, DNC, also known as dilatation and curettage. You take this big tube called a dilator, or a cervical dilator. It opens all of this up, and then this is your speculum, which also keeps the vaginal canal open. You see here, there's a serrated spoon that's very, very sharp, and that could scrape out the endometrial lining of your uterus. Now, we do that for diagnostic purposes. We also do that if there's things in there we want to remove, like polyps or potentially cancer, or cancerous or potentially cancerous material for biopsy. We can do it that way. But another thing that DNC, or that is infamously known for, is TOP, or termination of pregnancy, which is essentially an abortion. So if you have a any fetal parts here, you perform a DNC, and we also suction all parts out. That is considered TOP, termination of pregnancy, also known as an abortion. Let's see, fistula. Nah, I don't need to know what fistula is. Let's look at, oh, this breast tissue, also mammary tissue. And you could see here, there's your mammary glands, and they lead to mammary ducts. And then your breast is mostly this duct work and this sponge-like glandular work, but this also has a lot of adipose tissue, which is this stuff here. Another thing that's also important that you need to see here, even though this is not an anatomy physiology class, in real life, none of this is colored what it's colored. We color it a certain way for the textbook. This green stuff connotes immunologic tissue, and these are your lymph nodes, all these little beads here, and these are your lymph vessels. Within the lymph vessels, that has white blood cells and also lymph fluid, which help in the immune system. So ladies and also gentlemen, when you're doing your monthly BSE or breast self-examination, please make sure to check your axillary lymph nodes, because if there is cancer or infection or something here or foreign body, these lymph nodes will be inflamed. They may even hurt, right? And that's called a lymphadenopathy. And positive lymphadenopathies is indicative of breast CA. And do your breast self-examination monthly, please. It's better to see this stuff early than late. This is a lumpectomy. We're not removing the entire breast, only a lump or a piece of it. And then we'll monitor to see if we need to remove the breast or more breast tissue further. It's a way of maybe, especially for the more benign or the less malignant cancers of the breast, it's one way to try to preserve breast tissue as much as possible. Let's look at those other words that I just mentioned. Mammary glands. So mammary, Airy pertaining to what? Glands of the breast tissue. So if is called for, my patient has a mammectomy, ectomy, removal, and breast removal, surgical removal of the breast. Okay. How about if I want to have a boob job? If any of you were watching 90 Day Fiancé last night, so a certain character on there had mammoplasty. Now, plasty means what? Process of surgical repair of breast. That's why I have an issue with this definition where you have young people getting surgery, elective surgery, surgery that they don't need. And if you watched that show last night, she was in massive amounts of pain and massive amounts of drugs, and that's never a good combo. That's why I'm professionally and personally, I am not in favor of this stuff. If you're in my anatomy and physiology class, I can even elucidate that further. Here's male. Okay, so now we did female. Let's do some male. You can see there's a lot of similarities, but there are a couple of differences, obviously. Of course, you have your urinary bladder and then your urethra. You have your anus, which is the sphincter here, and the rectum, which is the tubing here. And you could see, this is your prostate gland. You could see why there has to be digital rectal examination, or DRE, because I can't feel it any other way. I can't feel your prostate gland through here or through your abdomen. There's only one way I could do it. I have to take a gloved finger, we KY it for lubrication, and then I got to go feel around it here. And trust me, it is no picnic in the park for the person doing it either, but it's something that has to be done on the regular basis. And also colonoscopy, especially after the age of 45, is something that should be done regularly, because we can see prostate CA, we could see colon cancer early. Male penis, as you could see, the head, also known as the glands. The scrotum is the sac that holds the testes. The function of the testes is to generate testosterone and create sperm, and it goes all the way up this tube called the vas deferens. So when, let's say this patient doesn't want to get his partner pregnant anymore, we do a vasectomy, and that will cut or remove a section of this vas deferens, okay? And then sperm can't travel through here, and into the penis and out. So we catch it before it goes out, okay? So let's look at some male stuff. Excuse me. It's been a long day. All right, androgens. Gen, anything that forms or produces or creates androgens. So androgens, male hormones like testosterone and androsterone, those things, if I inject it into a female, what are they now going to start having? They're going to have male secondary sexual characteristics. They're going to start growing hair in all the wrong places. The voice is going to get deep. And then you see some of these athletes, they have jutting of the jaw, nuchal prominence, which is like the back of their head gets really kind of thick. And you could see they start looking like guys, because a female has to have, has female hormones typically, and a male has male hormones typically. And that's why males put on way more muscle mass than female patients. But if I give my female patient androgens, right, in order to increase muscle mass, or as a performance enhancing drug or a PED, well, they're going to start developing male features. Your balanitis is inflammation or infection of your glans penis. Sex glands or gonads. So a gonadotropin is a hormone that stimulates the testes and ovaries. Now, you also may have heard of this word gonadotropin, because on your typical pregnancy test, you'll have something called HCG. HCG is human chorionic gonadotropin. 25-cent word, or maybe a 20-cent word. If we look at it, human, of course, it comes from human beings. Chorion, ick, pertaining to the chorion. Remember the amnion? Well, that's the sac that surrounds the baby. There's another sac that surrounds the baby, and that's called the chorion. And gonadotropin, gonad means sex hormone, tropin means growth. HCG is the chemical that we use that gets detected when you're pregnant. So your pregnancy test and the urine test and the blood test is trying to detect HCG, human chorionic gonadotropin. And 99% of the time, if there's HCG in mommy's blood or a female patient's blood, guess what? They are in the family way. Your testes, right? Orchism. So you can have Kryptorchism. If you look at here, do you see how the ovaries in females are up here? Well, male, if you attend my anatomy and physiology class on reproductive systems, male and female, prior to 6 weeks age of gestation, all of us have all the same parts. But then what happens? Genetics says to XY people, you're going to be a male. XX chromosome people, you're going to be a female, right? So this that used to be up here has to do what? Go down. Sometimes it doesn't, and it gets stuck up here. When it gets stuck up there, there's some issues with potential cancer. So we try to either try to bring it down surgically, or surgically we have to remove it, okay? And we'll go over why in anatomy and physiology if ever you come stop by my class. Spermatozoa, those are just simply sperm cells. So spermatocyte is another way of sperm cell. Spermicide, that's a chemical that kills sperm. And oh, by the way, that's the only difference between the hand sanitizer that's industrial strength and your hand sanitizer that you got at Walmart. Hand sanitizer you get in the hospital has nanoxynol 9, which is a spermicide, which is really, I find really weird. Like, what are you trying to say about hospitals, that there's like sperm everywhere? I just thought that was very odd. Years ago, I just bumped into it, just as a side note. Aspermia, let's look at this. Aspermia. Aspermia, state or condition of no sperm. But you could have oligospermia. And that's a state or condition of decreasing sperm. Okay. But remember, even though it's oligospermia, the person could still have children, so beware. Spermatocyte, aspermia, dilated veins are varicosities, also known as a varicocele, so varicose veins. That's when the valves of the vein that prevent backflow, they tend to fail, and then they back up, and then the veins become tortuous and swollen and painful. Vasectomy, that's the vas deferens. That's the thing that we cut, also known as we ligate, and so that you know, can't get somebody pregnant from the male perspective, of course. But it's only 99.8 or 99.7% effective, some ridiculously high number, because every once in a while, somehow sperm travels across the gap, gets in here somewhere, and gets somebody pregnant. BPH, benign prostatic hypertrophy. Remember, your prostate gland is here. If it gets swollen, it's going to mess with all of these tubes. So you'll have erectile dysfunction, also known as ED. You'll also have some dysuria, dribbling of your urine, a whole bunch of things. Here is your resectoscope for your urethra, also known as your urethroscope. You can see how we can go in there and we can perform something called a TURP, which is a transurethral resection of the prostate. So we go through the urethra, and then we go in there, and little arms and little loops retract in there, and then can cut and do surgeries in there. Here is the sample of vasectomy where we actually ligate, we actually take a piece out and then sew the other pieces. We even sometimes cauterize the pieces. We burn the ends of pieces, so make sure that that any sperm can get through. But every once in a while, it's very, very rare, but again, life happens. Here are some stuff that we went over: HRT, IVF. We didn't in vitro fertilization, right? That's has the misnomer of, test tube babies. LMP is your last menstrual period. PID is pelvic inflammatory disease, usually secondary to gonorrhea. That's some nasty, nasty stuff. It smells, and the person is in a significant amount of pain. Oral contraceptive pills, that's OCPs, pap smears. We already went through parity and gravity and the telephone code. TVH, yeah, I've seen it before. TSST is total shock syndrome, not too common. Total shock syndrome happens when someone leaves a tampon for a prolonged period of time within the vaginal canal, and then it gets infected. Usually happens with either the homeless population or somebody with mental defect or disease as well. TRAM, not too common. PSA, prostatic specific antigen, that's what we test for if there's any prostatitis. TERP, we already mentioned. BPH, DRE. ED is erectile dysfunction. That means what? Your male patient can't get it up. That's the quickest, most rotten way I could say it. But ED is the nicer way to say it. And I always make the observation, and you can take it as a will. I don't mean it as a joke, but every time I have a diabetic / cardiac patient, you tell them all of the horrible things that could happen to them. Kidney disease, they can go blind, you can die. They don't pay attention until you tell them their stuff won't work. And that's ED, erectile dysfunction. It's amazing. They could have chest pain. They don't come back to me. But the second their stuff doesn't work, I get a call. HPV, human papillomavirus, most common cause for cervical cancer. So we're during pap smears, we do an assay or a test for this as well. STI or STD, sexually transmitted disease, sexually transmitted infection. VD or venereal disease, this all means the same thing. Candidiasis, it's a vaginal fungal infection, Candida albicans. You'll have a white cottage cheese-like discharge. You'll also notice that in pathology, they always use like food descriptors to describe things. It's kind of gross, but it's a great way to remember it. Cervical CA, ectopic pregnancies. Now, what's an ectopic pregnancy? Let's look at that word, ectopic. Remember I mentioned twice actually that in the uterus, the best implantation is superior portion of the corpus, anterior portion. That's where implantation of when the sperm and egg meet, that's the best place to be. But ectopic pregnancy is everywhere else, and everywhere else is a danger to mommy, right? So what does ec mean? It means pertaining to. Ec means out of, right? Or outside of, and top means area. And ectopic pregnancies are not viable. They are actually very dangerous to mommy, especially in the form of hemorrhaging and whatnot. So you can see here, you have implantation in all these weird places. It's going to cause bleeding. It's going to cause obstruction. It's going to cause a whole bunch of problems. Endometriosis. Endometriosis is when the endometrial lining, endo, inside, right, of the the uterus gets grows out of control, and it kind of grows like cancer. So we pay attention to that. Let me look at what's an OM. I don't know what's OM. I am not familiar with capital OM. Miss Asso, if you could tell me if it's an abbreviation, or maybe someone can Google it. But and again, I'm not an obstetrician.
Yes, it's an abbreviation.
Yeah, but
pertaining to like
what does it stand
upper
for?
respiratory system.
Yeah, but we're in the reproductive system. So is it a reproductive question? I could look it up for you later, but I don't know what that is, to be honest. But you can Google look it up. Even for respiratory, I don't know what that is. OM. What would OM be?
Because when I Google it up, it's giving me so many like.
Yeah, but I'm telling you, like, I don't know. To be honest with you, that's why JACO has a lot of problems with the usage of OM, right? Why? Where did you hear it? Did you heard it at work?
In the assignment, no, in the medical lab.
In the medical language lab, they said OM.
Yes.
All right. Yeah.
So I've been searching. I don't know the meaning
So
of it.
what was the question? If you see
They
the
gave,
question,
yes, they gave. It was a question that they asked us to make a video without using abbreviation, so it has URIDXOMPE. Like they gave a patient something, then they gave those words in a sentence and say we should repeat them without using the abbreviations.
Yeah, so you just used a big, but you could skip that one, because honestly, I don't know what OM or maybe they misspelled OR, because OR is operating room. Everyone, that's universal, but OM, I don't know what that is. I've never heard that before.
Okay.
But you could skip that part, and because remember, textbooks, they're not flawless. They have multiple editors, but they could have mistakes.
Okay.
If we look at this, fibroid, potato, oid means resembling. So it looks like it's a bunch of fibers, but in reality, it's a benign neoplasm. And neoplasm means new growth. It means it's a benign cancer. So if you have fibroids or leiomyomas all along here, that's of consideration of if what we do is we try to get rid of the leiomyomas or the fibroids as much as we can. Then mommy has baby. Then afterwards, we'll do tabaso if mommy wants, because you can see that this space has to be nice and open for baby to grow. And if there's other things in its way, like a fibroid or another kind of cancer, that's never a good thing. Gestational hypertension, gestational diabetes. These two things are very, very important, because it means that the pregnancy is causing the hypertension or the pregnancy is causing the diabetes. Now, what happens when mommy's no longer pregnant? The hypertension and the diabetes go away. But here's the problem. Within the next 2 years, 3 years, the patient's going to be a diabetic / hypertensive patient. And it's something to pay attention to. My aunt was one of these women, and not even 4 years after she gave birth to her last child, she died of massive coronary, and her hypertension wasn't even that bad. But it was one of those things where, yay, we're happy to have a baby, and okay, your blood pressure is a little bit on the high side, but she was young, so everybody kind of ignored it, and not a good thing. You never ignore even the littlest of symptoms. Always deal with them. And hypertension could lead to this stuff called preeclampsia or eclampsia. You'll learn that in obstetrics. I don't want to get into it now, but just know that hypertension and or hypotension is never a good thing for mommy, never a good thing for baby. Locoria is common discharge from the vaginal canal, and it's normal in pregnancy. But we swab it, and we do culture, do a culture on it just to make sure that it's not something else. Sterility, that's easy. Toxic shock syndrome. I talked about that earlier. It's typically if you leave tampons or some foreign body inside the vaginal canal, or I've even seen things pushed all the way up to the uterus, and you have a really, really bad sepsis, and it's Staphylococcus. It's a really, really bad staph infection. Anarchism, that's no testes, because orchid is testicles, and an means no or not. Balanitis, we run Kryptorchism. Epispadias. Epispadias is when, the opening or the introitus of the penis should be at the top of the glans penis, but sometimes it's on the sides. My nephew had it years ago, and I just remember her mother, who isn't a medical professional, she was like, "Oh, because when Stevie was born, he peed sideways." And I go, "What?" And he was already a year old. And then we did a quick surgical thing, and hypospadias is also the same thing, where the urethra opens up on the wrong side, but it's easy to fix, and we do it, but it's relatively rare. Phimosis, stenosis, or narrowing of the preputial orifice or foreskin. That's the only real issue regarding foreskin. You just gotta pay attention to any potential what do you call that, infection, because the infection will cause stenosis of any tubing, right, will retain urine, and then you have really bad chronic UTI and a whole bunch of bad things. STDs or STIs, chlamydia, most common. And oh, by the way, ladies, chlamydia is almost 90% asymptomatic in males. So go seeing your gynecologist regularly and having it, especially if you're a younger person and sexually active person. Screenings for STIs and screening for HPV is very, very common, and it's kind of important because it'll prevent a whole bunch of issues. Here's your Copascope. This here is what they call a duckbill speculum. And this speculum here is to keep the vaginal introitus open and the vaginal canal open, so that we can visually inspect the cervix and inside the uterus. And this device here, which nowadays is much, much smaller, and it's fiber optic size nowadays, and then it projects onto a screen, and it can be recorded. It's really neat, and we could send it out to the specialist. This is your colposcope. Here is a laparoscopy, scopy, process of viewing, lapar, the abdomen. We either fill up your abdomen with gas or saline, and then we could do surgeries. We could do a whole bunch of things. And this is like, nowadays, the stuff that we use, it looks more like, it kind of looks like Xbox, to be honest with you. It's really neat. It's got a lot of controls and whatnot. Here, of course, is another view of your duckbill speculum. Okay, and here's a frontal view of your cervix. So you have your cervical os, the inner, and here's the outer, and then the vaginal canal here on the sides. DRE, digital rectal examination, especially we do this with males. You can see that's like the only way I can get at your prostate. That's a good. Oh, here's your episiotomy. We don't do it that way. That's bad, because it's going to create a fissure all the way to mommy's anus. That's not good. Usually cut here or here. Approximately 2 to 3 centimeters only. Modified radical mastectomy. Tram flap, I don't need to know that. Okay, let's look at some pharmacology. Wrapping this up. Antifungal. So that means it is a drug that will be against anti-funguses, or antimycotic. Let's write that down. Instead of antifungal, you could be anti-mycotic medication. And when you look at the word antibiotic, pertaining to anti-life, life of what? Life of a bacteria. So I give antivirals when I have a virus. I give an antimycotic when I have a confirmed fungal infection. Contraceptives, sep means conceive, right? I always remember sep means also head, cephalic, so it's against you seeing a head coming out there. For many of us, best time of our lives. For many of us, worst times of our lives, and definitely worst time, because very, very painful time for our patient. Oxytocin. Oxytocin is a hormone that gets signaled to your uterus so the uterus can contract, and that's when you get those very, very painful, very, very strong contractions. And we have this drug called Pitocin that does the same exact thing, and that's called a pit drip. Spermicide, we already talked about. Erectile agents. Erectile agents, they're all intents and purposes, the blue pill like Viagra and all these other wonder pills for erectile dysfunction, that's just, they're actually low dose blood pressure medication. That's all it is. And gonadotropin we already talked about. And last but not least, we're already at the level of the cases. So again, for this week, choose one of the cases, do a question. You could either do this bilateral vasectomy done by the urologist, Dr. Peter Falk, here, and he has is a operative report. I believe Peter Falk, isn't he an actor in the 70s? Oh, well. And then here you have in the emergency department, you have a woman here with vaginal irritation and discharge. That vaginal irritation, that's most likely pain. And there's a whole bunch of questions that you can easily do here. And again, lovely, lovely words here that you can do. Does anyone have any questions or comments with this week's Zoom or this week's assignments? Because if not, let's call it a night, ladies and gentlemen, because I have to do some tutoring. And whoever is my tutoring person for this evening, please stay on after everyone else is logged off. And if not, have a good night, everybody.